Careblazer, welcome. I am here doing a video from Tokyo, Japan, and I want to talk about a fascinating symptom that many people with dementia have, and also talk about what you can do if your loved one has it. It can be a dangerous symptom, but luckily there are things we can do to help keep our loved ones safe. If your loved one struggles with this symptom, then they are likely going to have clumsiness, where maybe they are more prone to bumping into things, tripping over things, and falling. They might even have more trouble using fine motor skills, like being able to zip something, maybe even button a shirt would be difficult for them. And you might even notice that they have problems walking. Specifically, their gait is altered. Maybe they're shuffling their feet, maybe they're not totally lifting their feet when they walk. These are all potential signs that your loved one might have this symptom. What is a symptom we're talking about here? We are talking about difficulty with proprioception. Sounds very technical, but I promise we'll break it down and make it as clear as possible. Proprioception is your body's ability to understand where it is in space. This is exactly the thing that allows us to walk and move around and move our legs and arms without having to look at it to know where it's going. It's the thing that's going to allow me to pick up this water bottle and put it down without even having to look at it. It's the reason I can close my eyes right now and hit my nose without having to look at it. It's because my proprioception right now is pretty good. But sometimes for people with dementia, they lose their ability to understand where they are in space. And when this starts to happen, we start to notice people with dementia have problems with coordination, with balance, and just being able to navigate and pick up things in their environment. Specifically, you might notice it in your loved one having difficulty getting dressed or even being able to move around furniture. This is also a reason why navigating stairs can be quite difficult for people with dementia, or even why making sure the home environment is safe is really important. Even things like carpets and throw rugs and dog toys or baby toys on the ground can be really difficult and dangerous potential situations for somebody who is struggling or having difficulty with proprioception. Here are 6 signs that you might notice in your loved one that could suggest they are having difficulty with proprioception. And if they have these signs or some of these signs, you'd certainly want to bring it up with their healthcare provider. Sign 1, increased clumsiness, tripping more often, bumping into objects, dropping things. That could be a sign. Possible sign 2 would be uncertain movements, where they seem more timid, more hesitant about what they're doing, about the next step they're going to take. Sign number 3, difficulty with those precision tasks, those fine motor skills like buttoning up a t-shirt, putting on clothes, zipping a zipper. Sign number 4, changes in their walking, specifically shuffling their feet, not picking up their feet, walking more slowly. Sign number 5, they are relying more on visual clues. Specifically, they might be looking more at their limbs as they're moving to try to make up for their difficulty. So they're looking at their legs and their feet as they're moving to try to make up for the fact that they're not quite sure where their legs are. And sign number 6, pretty big one, increased falls. Now, if somebody with dementia does have problems with proprioception, there are things that can be done. Number 1, like I already mentioned, please keep their healthcare provider up to date and informed about the signs that you're seeing. Number 2, which is super important, is a home safety assessment. This can typically be done by an occupational therapist or maybe even a physical therapist, where they can go into the place where the person with dementia is living and take a look at the environment and make recommendations about how to make it more safe for somebody who is having problems with proprioception. Simple recommendations that could happen here would be installing grab bars in certain areas, securing any rugs or carpets, even rearranging furniture to make it a more clear path. Other things that can be helpful would include adaptive equipment. These are basically tools that can make living life easier for the person with dementia. These include things like non-slip shoes and even clothing that's easier to take on and off. Supervised exercises can be really helpful. Again, this is an area where physical therapy or occupational therapy can come in handy, and they can work on increasing and helping somebody's proprioception through exercises targeted at improving balance. Incorporating some cognitive and sensory experiences can also help. For instance, doing things like chair yoga or even dancing exercise, all of these things are helping the person be aware more of their body. This also has the added benefit of stimulating their cognitive functioning. They're using their brain as they do those exercises as well. And finally, just education and support for you, especially the caregiver, but also for the person with dementia, depending on the severity of their dementia. It just helps to know why somebody is starting to have problems with these areas. It is a symptom that can happen. It's not talked about a lot, but it's very common. Again, it's called proprioception, your awareness of where your body is in space. These are things we all take for granted many times, and really starts to bring to our awareness just how important these functions are when we start to see our loved ones struggle with this. Now, I'm curious, Careblazer, have you noticed that your loved one might be having problems with proprioception? Have you noticed they're more clumsy, difficulty dressing, maybe difficulty walking, their gait has changed? Very curious. You can go ahead and leave it in a comment below. I'll be back next week, as always, with a new video. We have one coming up very soon on executive functioning. All right, sending you all love here from Tokyo. Bye. Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.